welcome to our coffee talk. I'm Cheryl, speech and language therapist of our Counselling and Speech Therapy.
And I'm Edmund. I'm a counselor here at our Counselling and Speech Therapy. Cheryl, I'm just wondering, if I send my child to you for speech and language therapy, can you guarantee that my child can speak fluently at the end of 1 month?
Wow, that's a tall order. I wish to tell you yes, but sadly, I'm not a miracle worker. There's no way I can guarantee any parents who walks in, asking this question as well.
That sounds a bit like an unrealistic expectation, right?
I would say so. I mean, especially if I don't know like what is the need of the child, then there are other factors in terms of like whether they can commit on a weekly basis, and whether they do the home practice at home.
So Cheryl, have you heard what kind of unreasonable expectations have you heard from parents?
What
are the things that they demand from you?
I guess I cannot say that I cannot fault them. Okay, not that I want to be politically correct, but I think a lot of times parents will come in with the expectations saying that, I want my child to be able, example for those who are language delayed, maybe the child only has single words, and then they will tell me that, I want my child to be speaking like his or her classmates who are speaking in short phrases or in sentences, and I'll be like, within a month it's not possible because we need time for language to develop. Or for those with speech clarity issues, some parents really, because they are with the child on a daily basis, so they will know that the child has certain sounds that they can't pronounce accurately, so parents will just zoom in and tell me, you just work on these sounds will do. I'll be like, okay, I hear you, but then we still need to look at what's the reason behind them being unable to produce these sounds also. So I think there's a lot of factors like what you mentioned. If within a month, not quite, unless they are like, it's really a milder case, I would say. How about your side of things? Any unrealistic expectations from parents?
Similarly, sometimes parents comes in asking for or hopeful to see improvement within a short period of time, usually a month or maybe 2 months.
Definitely.
So they want to see significant progress. That's one. At the same time, we also have parents coming in asking for, I want to improve on this behavior, I want to get this behavior sorted out, I want to see improvement in this area. So there's like a lot of different things that we will need to work on. And they expect me to work on all of them at one go, which is a bit hard. So usually I will prioritize certain issues first. There are certain issues or certain behaviors, it will be later on. But some parents want it like immediately. Everything at one go, which is a bit difficult sometimes.
Of course. Must make use of the the entire session and get the most out of it. Definitely, I understand from the point of view as a parent. But oftentimes, because we know like, there are certain things that we need to work on immediately, but certain things have to take a little bit of time. So that's why we will prioritize what needs to be worked on first, right?
So what factors would you look at to determine how fast or how slow a progress would look like?
I think firstly you have to be very honest whether the child has any diagnosis or so. If let's say today, if the child walks in with no other comorbid condition and it's more of just like a speech clarity issue, and the child has good cognitive ability, able to, and compliance also. Whether the child has any behavioral issues.
Resistance.
Yes, or task avoidance. If let's say the child is totally like reluctant to come for therapy, I think that is one thing that I have to really look into and have to advise parents like, perhaps we need to find out what's the root cause of this behavior. Sometimes it could be because of self-esteem issues, like they are so aware of their inability to speak clearly, then it makes them feel very lousy about themselves. Then that will be more of like a social emotional kind of need, which I think that has to be addressed via counselling first. So and also parents, whether they are, I wouldn't say compliant, but then whether they are supportive at home also. Like example, if I finish the session and were to share strategies with them and suggestions, what they can do at home. But if parents just, okay, good, yes, but nothing happened within that week, then I think that is another factor. Because I'll honestly share that as a therapist, I'm not a miracle worker. I can't possibly just, work with them once a week and then hope that everything can be done, will fall into place. Because that will only be skills learned in the therapy room and not generalized to whatever they are supposed to be doing at home also, and maybe in school as well.
This point I totally agree with you, because in counselling we do the same thing. After a session, usually I will have some recommendation for parents to try it at home or to continue certain practice at home.
Yes.
We do see parents who are very consistent in practicing, and we see some much faster improvement in that.
Definitely.
The other extreme, we see parents that are, like you say, a pay lip service, say, oh, okay, we'll practice, but then in the end, next week, oh, I forgot, or things got busy and didn't get a chance to practice.
Yeah.
And then we see much slower progress in that.
Yes. But having said that, we're not pointing fingers at anybody, because we know that everyone is also busy.
Yes.
But definitely, if you want to ensure that there's consistency in whatever they are learning, and also I think like the consistency whether they come for therapy.
Yes. I totally agree with that, right? For me, I'm not sure for you, for me, I would really hope to see the child like really at least weekly. And I do notice that the child that I can see weekly, I see much better improvement versus a child that comes in like maybe once or twice a month, or sometimes they pause because of holiday, because of certain things that happen at home. Those are unfortunate things that I cannot blame the parents lah.
Definitely.
I think if parents can be as consistent as possible, not to skip any week, that would be really great. I mean, we can see much better progress.
True.
Because then the behavior, the practice that we do is reinforced every week, rather than you practice 1 week and then you stop for 2-3 weeks, and by the time you come back, they have forgotten, or you need to refresh all over again.
Yes, they would have forgotten. We would have also forgotten, because it would have been quite some time also. And I think like what you mentioned, is on the extreme end also, there are parents who ask, hey, how about we come 2 to 3 times a week? Not that we don't want to earn that money, to be honest, but sometimes it gives a lot of pressure on the child also. And the parents also having to send them to the clinic
every week.
2 to 3 times a week is really a lot of effort and persistency, right? Which translates, they might as well do it at home with them, right? The strategies.
But is there a chance, or is there a time where it really needed 2 to 3 times a week for speech and language?
I guess so. Let's say if the parent is really urgent, and I really do see the need that, okay, maybe they are trying to fulfill a certain timeline, or they wish to attain certain things, like just an example, if they were to migrate to another country, and they say, oh, can we get a few more sessions in or not before we leave? Or like, oh, my child is really almost school age, like at 6 years old. Going
to go to school soon.
Yes, and they see like, oh, can we do something more? Then I'll say, okay, we can try. We can definitely try it out. But of course, also need to depend on what the child's, how receptive is the child also. Yeah.
I also know parents, sometimes when we give them practice, they want to do it every day with their child, right? They want to practice every single moment, every single day, every chance that they get. Do you think that would be helpful?
I think yes and no. Depends on how they do it also is very important, right? I guess you also would have faced this kind of question also. So usually my advice to parents would be, yes, I can give you example, a worksheet. But you don't have to do it in a single day. You can spread it out, across 2 to 3 days to work with the child, because there are different activities in that worksheet. Or for some like the speech clarity practices, right? I would tell parents, I say, please don't do it every single day. Don't do it 24 hours a day. I mean, other than them sleeping, I said maybe just 15 minutes to 20 minutes, and find a time that the child really is emotionally stable, not when they just wake up in the morning.
Not when they're tired too, right? Or hungry.
Yes, and not when they just came back from like school, Then parents will be like, oh, really? Just that 15 minutes is enough? Shouldn't we, the more we do, the better it is? Well, then I will tell them, do you like it if somebody police you, like the way you talk, the way you are, whether you are clear or not for an entire day? That's so draining, right? So as much as I know they mean well also, but it can be very pressurizing for the kid also. I believe like emotionally the kid wouldn't feel well also. How about for your side?
For me, usually I will recommend, or I will give parents homework that are more fun in nature. All right, more play-based, more fun in nature. So the first thing that I always tell parents is that make it fun.
Yeah.
Don't make it like a chore that okay, we have to do this, like let's do this homework, that will take away the fun, right? And then when it's not fun, the child would not want to practice it. Right?
Yes.
Similarly, I will ask them to pick time when it's not tired, not hungry, not when they just had a meltdown. So these are the times that it doesn't or rather the learning doesn't stick in a sense because they are so tired, they're so hungry, they'll be whining when they're doing it, and then they just find it a chore, right?
True.
2 to 3 times a week, I think is good enough. Of course, if they can do it every day, but in a short duration, I think it's also okay. Not 24/7 lah, definitely, right? Yeah. If I'm the child, I can imagine if 24/7 I have to keep practicing this, I will be tired, I'll be bored.
Yes.
Even if it's a fun activity, if I do it more than 5-6 times, it no longer be fun.
Yes,
right?
Yes. I
Become
agree.
a chore.
Yeah, and I think there are parents on the extreme end who will say, "Oh, I can't get him to do anything." I don't know why. He only listens to you. When he comes to ours, he will do anything. But when I'm at home, I try to get him to do whatever you suggested. He's reluctant. Yes, we do see that as well. So that's why we really think that it's so much more like when we actually prescribe homework, it's so much more than just practicing the skills. It's more of like see it as a form of connection also. Like you spending some time with
building the
child.
relationship, right?
Yeah. So I think in that way also like having a more cordial relationship rather than oftentimes just hey, why you never do your homework? Faster do your homework. So from the point of view, I guess like maybe building connection, maybe you like to share a bit like how would building connection, focusing on the relationship will be beneficial?
I think very natural children will listen to you when they like you.
Yeah.
Right? So connection is definitely a good start, right? If they feel connected to you, if they like you, if they know that if I make mistake in front of you, I won't be scolded. If I make mistake in front of you, I won't be judged. I won't be shamed. Naturally, they will want to follow your instructions, right? I think it works for adults too, right? Imagine if your boss every day scolds you, make fun of your work, laugh at your quality of work. Naturally, you'll be demoralized. You wouldn't want to do that.
I hate my boss.
The same for the children, right?
Yeah.
So, and that's why also, like I said earlier on, I will always prescribe activities that are a bit more fun in nature, while also practicing the social emotional skill that they need.
Yes.
The fun nature helps to build the connection too. Right? Yeah. At the end of the day, no point practicing this skill, but at the expense of the relationship.
Yeah.
Right? They get the skill, but they don't like you at the end of the day. Then that's not the thing that we want.
Yes, I think that reminds me of a success story, I would say, because the girl actually has a language delay and some speech clarity difficulties also. So initially, parents were highly anxious about it because she's not catching up with her peers. So there are expectations from daddy and mommy saying that, oh, she's coming for therapy, but why is she not picking up? Like immediately, I was like, whoa, immediately. I was so pressured at that moment. I was like, okay, but continue doing whatever you're doing because parents are very consistent in their homework. In fact, I would say too consistent. Like they will be, oh, but we are practicing so hard, on a daily basis, but she's still like that. And I think eventually, after speaking to you also, then parents got to understand, oh yeah, the emotional side of things is very important also, the connection. And in fact, recently the parents came back and shared that, when they take a step back, they try to be a little bit more calm, more relaxed around the child. Actually, the child started talking more with them. And as more accepting when parents try to help her correct her speech sounds also. So I think like what you mentioned, connection is really, really important.
And to let go of some other not so important things at that moment. Not saying that you don't care at all, but maybe at the moment, let's focus on just one thing at a time.
Yes.
Rather to work on behavior A and speech B, and then this thing about SEL, and there's so many things to work on. And if you hop on every single thing, you'll be very tired. The child also very demoralized.
Yes, it's true. And I think one important, critical thing that I want to say is really to remember that they are still kids.
Yes.
And they are so young. I mean, even for adults also, like what you mentioned, if my boss were to like hunt me down and tell me that, hey, you never do A, B, C, D, E, F, G, I would like, oh. Yeah, especially for a young child, if we were to put our own expectations on them, they will get so pressured. And at the same time, they might feel like, oh, because it's daddy and mommy, I don't think I can, shout back or talk back, that sort of thing. Then they will feel so pressurized to perform also. Yes. And to be honest, I think a very easy way to so-called like escape is really to either shut down or to be very angry with the parents as well.
So tantrum, right? And don't want to do it anymore.
Yeah, then it will be just a vicious cycle because parents will feel that, hey, why are you rebelling, throwing your tantrums? Then they will be like, oh, so they really behavioral. I cannot control them also.
Yeah. So usually I will tell parents, let's focus on one thing at a time. Yes, we have maybe 10 things to work on, but let's sort out one thing first, right? When we sort out one thing, there's 9 more things to go, then one more thing, then 8 more to go. So rather than you focus on 10 things at a time, and you get nowhere with all 10 things.
Yeah,
right? Because emotions are high, you are disappointed, child are stressed out,
Yeah.
They're just going in circle. Yeah.
Yes. So I think it's to really like, try to focus on whatever that is important at that time point, like what you mentioned. Because parents are also tired.
True.
Yeah. So really pick your battles,
yes.
right?
Pick the battle. Very good one. Yeah, pick the battle. Yeah.
Yes. Okay. So any other tips that you would like to share with parents?
I think importantly is do consult professionals.
Okay.
Right?
Yeah.
Because we may have our expectation as parents and we see our child's friends are progressing so much better. Naturally, we'll be very concerned. But that doesn't mean that my child is lacking.
Yes.
Right?
Yes.
Just because my child's friend is advanced doesn't mean my child is lacking.
Yes, definitely.
Yeah. So,
I get what you mean.
But I think a lot of parents will get anxious when they see that other people are getting ahead. Hey, how come my child is not getting ahead? But it could be normal. It could be they're on par.
Meeting, right?
They're meeting expectations.
Yeah,
the
milestones.
Right?
Yes.
Yeah.
It's just that some kids develop faster.
Yes.
Some kids still need a little bit of time.
Right.
Yeah. So instead of just like, going through the internet and just like searching, like say, the milestones for age,
why my child is not doing this or why my child is not doing that at the moment, right?
Speak to a professional to find out more.
Especially, I think because there are things like, sometimes whether the child is born in the beginning of the year and they're born at the end of the year, but they are joining the same level.
Yeah.
But they could be like 12 months different because one is in January, one is in December, but they are all in, say, P1.
Yeah.
Naturally, you will see a difference, right?
True.
In that case, the slowness or the not catching up is normal because this child is 12 months
developing.
12 months slower than the other boy who is born in January, right?
So
I think parents have to take into account
True.
when saying that, hey, is my child okay? Is my child doing well or not?
Yeah, very good point. I think this is a system, academic system that is something that we can't change. Correct. But I do understand in like some other countries, they take that into account also.
Really?
Like in Australia, previously when I was in Australia, they would actually look at the month the child is born in also.
Okay, I didn't know
up
that.
to the month. Yeah, so it's very precise. Like maybe if let's say this child is born in the second half of the year, he can't join the same age. He'll join the one after.
Subsequent. Okay.
Yeah, because that's how they believe like the developmentally like it's by half a year kind of thing, rather than like one full year.
I think that's much more precise in a sense, right? So that's great.
Yeah, so it really helps them to ensure that not to pressurize them to perform also. Yeah.
So go back to parents who are worried. Yes, you can be worried, and it's normal to be worried about your child. But sometimes our worry may be unfounded in a sense. Not saying that you
not
can't,
dismissive,
right? Not dismissing your worries, but just that it could be just a worry, right? But let's check with a professional whether is it true that there need to be intervention, or is it like, hey, even though I'm worried, but actually things are okay,
Yes, definitely.
A lot of times it's like that because we do have people who come to our center for consultation, and then we realize that things are pretty okay for the child, and they don't even need intervention, and we send them off and say that. No need to worry, things are okay.
Or we just monitor along the way. If you do have any other concerns, come back. We always welcome you back. Even if you want to give us a call and just have a chat, why not? Right?
So for you, Cheryl, what is an expectation that parents should place when they start SLT? A reasonable one, not an unreasonable one.
Okay, I think firstly I would hope that they are already ready to start therapy.
Okay.
In terms of like them being committed also.
You mean the child or the parents?
The parents. The
Okay.
parents. Yes, the child usually I think they are more or less okay to begin. Yeah, and I mean depends on their age also. Yeah, so if they come in quite young, like preschool age or school age or even like teens, I think usually they are quite okay.
Yeah.
As long as their parents were to bring them here. Yeah. I would think parents, because sometimes parents are still quite undecided also.
I see.
Like sometimes they might be like, oh, the distance, the day of the week, the timing. Of course, we do our best to accommodate to the timings. Yeah, but distance is not something that we can change.
Yeah.
So they must be ready, like mentally prepared that, oh, I'm willing to travel this distance. I'm not saying every day, but once a week. And then also the commitment to whether they will listen and try out the strategies at home, the home practice. I think that's very important because we do see a vast difference in like the improvement of the child, whether they do their home practice or not. Yeah. And also, perhaps really it depends on how complex the case is also. I would say definitely we would see some gains, at least some form of gains, regardless of like, is it speech, language, at least within a block of therapy.
And sometimes growth might be slow, right?
Yes.
But it doesn't mean they are not developing, they're not growing.
Yes.
Just that we may not observe it so much, but they are still progressing, right?
Yeah, definitely. Yeah. So how about your side?
Quite similar to what you said. We're ready to be committed. We're ready to come regularly if needs to. Growth can be slow. The other point I want to point out is that sometimes parents also need to expect that sometimes there may be regression. You may see that they're taking 2 steps forwards. Sometimes they may take 1 step backwards for a while before they move back to forward. Alright? Yeah. I think as long as overall there's an improvement, I think it's okay. Once or twice regression, I think it's fine.
Yeah.
For example, let's say they're here to work on their anger issue.
Yes.
If they lose their anger once or twice, it's normal. I mean, you don't expect them to not to lose their anger at all, right? Yeah, just human, right?
Yeah.
So one time they can manage themselves, the other time they can't manage themselves. I think these are all normal and within expectation.
Yeah.
You know? And when we're in doubt, always come and talk to us and ask us, hey, I don't see any progress, or hey, I see this happening at home. Is it okay? Is it okay? So I think having that conversation helps to clear things up rather than you keep thinking it's not working and then you change another therapist without asking or without sharing, and then the child has to start all over again. And so things might jeopardize the progress, you know, if you do that.
Yeah, I do understand. So from what I hear is like progress isn't linear all the time, right?
Yes.
It's really up and down. So it's good to have open conversations with the therapist also. I mean, regardless whether it's us. But and I think like to really share your concerns also, like as parents, right? What do you hope to really see?
Yes.
Yeah, because sometimes the expectation can be so sky high. And then it's like if we only given that amount of time, it's really hard for us to reach that goal. Yeah, but having said that, there's still like small little goals
that we can move towards.
To attain also before reaching that bigger goal.
Yeah. All right. Great. I think that's all for today. Okay?
Yes.
We will see you again next week.
Yes.
For our coffee talk.
Yeah. Remember to
like, comment, subscribe.
Yes. Okay.
Bye.